Well, New Yorkers have recently reported a dry cough accompanied with no other symptoms of illness.
And WENY's Stan Berman joins us live in studio this morning with more on what this mystery illness may be and some treatment you can take. Good morning, Dan.
Yeah, that's right. Good morning, guys. Well, according to the New York Post, there has been an uptick in lingering cough cases all across New York State. I spoke to family practice physician Dr. Christopher D. Facito to learn more about ways we can help treat and prevent ourselves from contracting it. Are you experiencing a cough that just won't seem to go away? Well, if so, you aren't alone. Local doctors are seeing an uptick in New Yorkers getting a persistent cough that's a separate illness from other respiratory viruses.
I think there's been a lot of this dry, hacky cough that's been going around the state, and it's been independent of flu, COVID, or RSV. So that testing has been negative.
Dr. Christopher D. Facito is a family practice physician at Guthrie. He says the new viral infection can last up to a month before seeing relief.
The cough has been lasting for about 3 to 4 weeks, and it starts with an acute illness, but what can end up happening after any viral infection is that the cough can last for sometimes up to 30 to 40 days. So I think that's a lot of what we're seeing in the area right now.
In terms of treatment, over-the-counter medication is best recommended, with the exception of those who suffer from an underlying medical condition.
The only thing I need to remind folks is that if they do have an underlying medical condition such as hypertension or coronary artery disease or any other vascular disease, that sometimes there can be interactions between those medications and medications that they may be on. So it's always wise to talk to your doctor before starting any over-the-counter cough and cold medication.
My last question here for you, Doc, is about the humidifiers, of course, inside of the homes. Do you agree with this? Do you think this is something that could be beneficial?
I think humidification of the air is good in addition to the over-the-counter medications people will use for symptomatic relief. So it can give them some good relief over time.
Dr. Facito adds one of the biggest reasons for this cough outbreak is the season we are in, where we're being indoors and close to one another can cause bacteria to spread quicker. Guys.
All right, thank you, Dan. All good things to note. Well, now switching over to the